name is Toni Trexler. I'm a registered nurse, and I am currently a student at Wilkes University, and I am going to be performing a general health assessment on Amanda Kemp, who has agreed and signed the waiver. Hi, Amanda.
Hi.
Hi. Tell me how old you are.
27.
Okay. Married, single?
Married.
Any children?
One son.
Okay. And how old is he?
4 months.
All right. And what do you do for a living, Amanda?
I'm a teacher.
What grade do you teach?
First grade.
Okay. Where do you live?
College Station, Texas.
Okay. And anybody refer you
No.
to us? Okay. And are you seeking care for any health problems right now?
No.
And then why are you here?
Just a general assessment, see how I'm doing.
Okay. So, all right. All right, Amanda. Tell me a little bit about yourself.
I was born in Fullerton, California. I was pretty much raised there until I was about 14, where I moved to College Station, Texas, and then graduated from Texas A&M University in 2011 with a bachelor's in education, and I've been a teacher. This will be my 6th year.
Okay.
And met my husband in high school, and we've been married since we were 23.
All right. What does your husband do?
He is a physical therapy technician, and he's also starting a physical therapy school for his doctorate.
Oh, okay. Okay. And does he work full time?
Yes.
All right. Do you live in a apartment? Do you live in a home?
We just bought a house a month ago.
A month ago. Wow. Okay. Do you have any family?
My in-laws live here in College Station, and then my mom lives in Oklahoma, but she visits quite often, and we talk every day.
Okay. Any community involvement at all?
We go to church every Sunday.
Okay. So I'm thinking that you have a new house, new baby, husband's in school and working. Just looking at support groups. So their church and family is a great support group. So you have a lot of support.
Yes.
Okay. How's that going as far as stress with all this going on? Any depression, anxiety you experiencing?
No.
Lots of suicide or anything like that?
No.
I just want to ask. Okay. So things are going good.
Mm-hmm.
Okay. All right, Amanda. Tell me, what medications are you currently taking?
Birth control. I've been taking birth control since I was 18, but this one I'm currently taking, I've been taking for 10 weeks, and it's new.
Okay. And you take them as directed?
Every day.
Every day. Okay. And do you take anything else, over the counter, vitamins?
I
anything
take
like that?
prenatal vitamins
How often do you take those?
daily.
Okay. Is there any other medications you take on an as-needed basis?
I have an inhaler for allergies.
Okay. The allergies?
Environmental allergies.
Okay. And do you know the name of your inhaler?
Dulera.
Okay. And so you use that as needed?
Mm-hmm.
How often do you think you use it?
Twice a year.
Okay. Okay. Any allergies to foods or medications?
No.
Have you ever smoked?
No.
Do you drink alcohol?
Yes.
Okay. How often and what?
Usually a glass of wine 2 to 3 times a week.
Okay. Any use of illicit drugs, street drugs, anything like
No.
that? Okay. Any childhood illnesses that stand out that you know you've had?
I had chicken pox when I was little. I was told I had whooping cough
Okay.
and pneumonia when I was about 8.
Okay. Have to be hospitalized with any of those?
No.
Whooping cough and pneumonia? Okay, so just treated on an outpatient basis then.
Mm-hmm.
Okay. All right. What about any medical problems? Any injuries? Any surgeries?
When I was 16, I got a concussion from playing soccer,
Okay.
and I also had a septoplasty for
Okay.
a deviated septum.
Okay.
When I was 18, I broke my left side rib. It was my fifth one.
Okay.
And then when I was 21, I had a tonsillectomy.
Okay.
And when I was 27, I had an abscess drainage.
Okay. Abscess drainage of what? Of what area?
My breast.
Okay. Your
left
your
breast.
Your left breast. Okay. And what happened there?
From breastfeeding, I got mastitis, and
Okay.
it ended up turning into an abscess.
Okay. Were you hospitalized for that?
No.
So you had surgery for that?
Yes.
Okay. And you've recovered?
Mm-hmm.
You're still breastfeeding?
Yes.
Okay. Without any problems?
No problems.
Okay. Anything else that you can think of? That's pretty much it as far as, so you've had a concussion at age 16, a fractured rib.
Oh, I also broke my arm in 6th grade.
Oh, okay.
And my collarbone
Oh, okay.
my collarbone in 3rd grade.
So you were about what age, do you think?
6th grade, probably about 11.
Okay.
Collarbone, maybe 7.
Okay. Wow. All right. Everything works now, though?
Yes.
No problems, no. Okay. Were you ever hospitalized, or did you ever have any great illnesses as an adult?
No.
Okay. We talked about mastitis, we got all that. How many times have you been pregnant?
This, just the one.
Okay. Full term?
38 weeks.
Okay. Any abortions, preterm deliveries, anything like that?
Nope.
And one delivery?
Yes.
Okay. Normal?
Yes.
C-section to
Vaginal.
Did we talk about that? Vaginal. Okay. At what age did you begin your periods?
About 13.
Okay. Normal periods?
Mhm.
No problems?
Yep.
When was your last period?
July 30th of 2015.
It's about 13 months ago.
Mm-hmm.
Sexually active now?
Yes.
No concerns about contracting any STDs or anything like that?
No.
Okay. Immunizations. As a child, did you have all the childhood immunizations
Mhm.
that you're aware of? Any other vaccines or?
I get the flu shot every year.
Okay, good. Anything else?
No.
Shot or anything like that?
No.
You haven't been given the Hep B, the H1N1 or?
Not that I know.
Oh, that was all. Okay. Last Pap smear.
June of 2016.
Okay. Any mammograms
No.
today? Do you do self-breast exam at all?
Not really.
Okay. Have you checked like your breast since you've had your surgery at all?
Not lately.
Okay. But you're not having any pain or anything?
No.
Okay. I'm going to talk a little bit about family history. Now, talk to me about your husband.
He's 27,
Uh-huh.
and he's very healthy and active.
Okay. Your son?
4 months, healthy.
Okay. Do you have any siblings?
I have a younger brother who is 23, and a younger sister is 25.
Okay. And do they have any health issues?
My brother just has had a tonsillectomy.
Okay.
He was about 21.
Okay.
Otherwise, he's healthy and active. My
Okay.
sister, she's a smoker.
Okay.
She also suffers from some anxiety and depression, which she's on medication for, and something about polycystic ovary syndrome, I think it is.
Okay. All right. Does she take medicine for that?
I'm pretty sure she does.
Okay. Okay. So she's doing okay. She's active. She's
fairly active.
okay. Now tell me about your mother and father.
My mom is 54, very healthy and active.
Okay.
My dad is 54, very healthy and active.
Okay, good. Your parents together?
Divorced.
Okay. Right, you had said your mom's in Oklahoma. Where's your dad?
California.
Okay. Any of them remarried?
My dad is.
Okay. Everybody gets along fine,
Mm-hmm.
so that's not a stressor.
No.
Okay. Tell me just quickly a little bit about your father's parents. Does your paternal grandfather have any conditions?
My grandpa was an alcoholic,
Okay.
but he has stopped drinking.
Okay.
He has cataracts and
Okay.
arthritis.
Okay.
My grandmother is a smoker,
Okay.
and she had skin cancer.
Okay. Skin cancer now, or
No, just she had it. They surgically removed
Okay.
some skin from above her lip.
okay? So that was outpatient, not
Mhm.
hospitalized.
No.
No chemo or anything
No.
like that. Okay. You said she currently smokes.
Yes.
So how long does she smoke? For a long
She's been smoking about 50 to 60 years.
Okay. And in what age range would you say that your grandparents
I
are?
think my grandpa is 73 and my
Okay.
grandmother is 72.
Okay. What about your mother's parents?
My grandpa he's about 85
Mm-hmm.
and he has, I believe, diabetes and high blood pressure.
Mhm.
He had prostate cancer and had it removed surgically.
Okay.
He also had open heart surgery. And then my grandmother on my mom's side is about 88,
Mm-hmm.
and she has arthritis, and I believe she had pneumonia a couple years ago and was in the hospital for it.
Okay. So your grandfather had open heart surgery. Do you know if he or your grandmother had high blood pressure then?
Yeah, I think my grandpa does.
Your grandfather. Okay. All right. All right. So, okay, got a good picture of that. I'm going to just going to talk to you a little bit about safety, which is kind of important these days, and with skin cancer, and you have a little one in the house. So as far as keeping toxic solutions and cleaning fluids and medications, do you have those high up, or do you have child-proof locks on them?
The medication is pretty high up in our medicine cabinet,
Okay.
but as far as cleaning stuff, it's not locked. But I know once he gets mobile, we'll lock it.
Okay. Growing up in California, exposed to a lot of sun, did you use sunblock?
Yeah, we always had sunblock on. We wore t-shirts over bathing suits or hats. We would also wear the zinc on our face.
Okay. And used, okay. You seatbelt in your car? Baby's in appropriate car seat?
Yes.
And position belted in? Okay. So, okay, I'm just going to kind of review systems real quick. Okay, systems meaning, kind of head to toe. I'm just going to talk to you a little bit about it.
Okay.
And as far as your skin goes, have you noticed any rashes or spots that are of concern or anything that bothers you?
No,
Okay,
I do have facial acne though.
okay. That's something you've lived with for a while?
Since I was about 16.
Okay. No super big problems like you had to have little surgeries or anything like
No.
that? And maintained with
Just face wash.
face wash? Now, as far as your head, you said you did have a concussion when you were 16. Did you have any problems directly after? Any severe headaches, any memory loss, any seizures, any visual disturbances, anything like that?
Just a little bit of dizziness right after it happened, and then a headache for a day or two.
Okay. And nothing since then?
No, nothing since
Okay.
then. No memory loss or anything.
Vision? Do you wear corrective lenses at all?
No.
Contacts?
No.
Last time you had an eye exam?
18.
Okay. No problems with double vision, blurriness, floating things that you see in your vision?
No.
Okay. What about your hearing? You have good hearing? No pain, no wax buildup? You've never had to have anything done to your ears that
No.
you're aware of? Okay. And sinuses, you had a septoplasty? Can you still breathe pretty good through your nose? Okay. Any problems with your sinuses? Do you get any infections or?
I've had maybe 2 sinus infections since the surgery, but otherwise that's pretty much it.
All right. Any problems with your throat, swallowing? You had a tonsillectomy.
Mm-hmm.
Any throat infection since then?
No.
Okay. Any problems with the gums in your mouth? Anything in your on your tongue? Anything that bothers you? Sore spots? Anything like that?
I get cold sores when I stress.
Okay. When was your last cold sore?
I have one right now.
Yeah. You got a lot going on right now.
Mm-hmm.
Okay. Back to the ears real quick. You've never had any ringing in your ears?
No.
Um, and we talked about dizziness or, okay.
No.
Teeth are okay to get regular dental checkups?
Yes.
Okay. No big problems and had to have teeth pulled or abscesses or anything like that?
No, just one cavity.
So yes, established swallowing is fine.
Mm-hmm.
Any problems with your neck?
No.
Notice any big swelling under your neck at any one time?
No.
Okay, you can move it kind of all around without any difficulty.
No problem.
Okay, and we talked about breast or mastitis. No problems, everything looks normal.
Mm-hmm.
No different kind of drainage other than the breast milk. No pain. Okay, and as far as your lungs go, any recent coughing, wheezing, difficulty breathing, anything like that?
No.
You feel your lungs have been working pretty good lately?
Yeah.
And do you sleep well at night?
Mm-hmm.
Do you sleep on your back or on your side?
My right side.
Okay. Do you use any device to help you sleep, like a CPAP machine
No.
or anything? Are you a mouth breather? Or
Yeah.
do you wake up through the night at all?
No.
Okay. Did your baby wake up through the
No.
Yeah? Wow.
Hopefully.
Excellent. Okay. Let's see. And you do get sports-induced asthma, you said?
Yes.
So, okay. But other than that, you don't use an inhaler and allergies. Any heart problems, chest pain, rapid beating heart, what we call palpitations, funny beats?
I've noticed maybe once or twice that's been kind of a beat really fast or get kind of offbeat, and I think it's just because I did not drink coffee throughout my pregnancy and have started drinking it again. So.
Okay. You ever had an EKG?
No.
What about your appetite? How is your appetite?
No.
So it's pretty good.
Mm-hmm.
Any nausea, vomiting, indigestion, reflux? You ever take Tums or Rolaids or anything like that? Okay. Do you have regular bowel movements?
Yes.
Okay. How often? How many a day?
Twice a day.
Okay. And what would you say? Are they hard, diarrhea, soft?
Soft.
So pretty normal. You ever notice any blood in your stool?
No.
Any pain?
No.
Ever been told you have gallbladder problems or ever suffered any kind of problems here that shoot through to your back?
No.
Okay. Never been told you've had liver problems?
No.
Ever turn yellow, your eyes, whites of your eyes turn yellow or anything like that you've noticed?
No.
Any problems with urination?
No.
Okay. Ever notice any blood in your urine?
No.
Any pain? Any mid-back pain at all? What we call our flanks?
No.
Do you get up often through the night to pee?
Usually just once.
Just once?
Mm-hmm.
Okay. Any stress incontinence? And by that I mean when you cough or laugh, do you pee your pants a little bit?
No.
Okay, good. All right. And you had a vaginal delivery, episiotomy, everything healed fine? No problems? You haven't noticed anything wrong with your genital area?
No.
Okay. Any pain with sex?
No.
Okay. When was your last pap smear?
June 2016.
Okay. And you said that was normal or negative?
It was normal.
Any history of varicose veins?
No.
Okay. Any swelling in your ankles, your feet? Anything like that? Any joint pain? Do you have any back problems? Anything wrong with your back? And you can move around, no problem.
Mm-hmm.
Okay, good. And we talked kind of about anxiety, stress, depression, and all that. And you said you pretty much got a good handle. You don't feel that you're, excessively depressed. And again, as far as your neurological, I know we had that concussion. We talked about it. So No fainting, no seizures, no blackouts, no memory loss, no numbness, tingling in your hands or feet or anything like that. You're able to move everything. Any unusual bruising, purple spots, red spots? Ever told you were anemic?
No.
Okay. Ever told you you had thyroid problems?
No.
Any intolerances to cold or hot, to where you'd be wearing a jacket in 80-degree weather?
No.
Okay. And any excessive thirst, excessive urination at any one time, excessive hunger, anything like that?
No.
Signs of diabetes, since you said your grandfather had diabetes. And you sweat normally. You don't have weird, periods of sweating when you shouldn't.
No.
Okay, very good. All right, well, I think that's good right now for the general assessment, and I think we'll get ready and do physical assessment on you and see how everything looks, okay? Okay, thank you. You're welcome.